This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
There's a disturbing trend going on that you may have heard about. People wanting to feel more energized and more upbeat and less stressed out from their busy lives. So what they're doing is they start their morning with a little coffee and a prescription narcotic called Oxycodone. Well, soon they find themselves addicted and with a much more serious problem. Well, joining me now is Dr. Stuart Kloda. He's an addiction medicine physician here in New York City. Dr. Kloda, good to see you. Thanks for coming in.
Good to see you.
So let's talk about this. The kind of people that you're talking about, these addicts here, they're not your usual addicts. Right.
Well, it's a subset of people who are addicted. It's basically professionals, working people, people that are coming in for treatment while they still have intact families, jobs, careers, that type of thing. So they realize that they're starting to have a problem and they come in before things get really bad.
Right. So when we're talking about oxycodone, we're talking about a prescription narcotic that these people are hooked on?
It's a prescription narcotic, correct, although most of the patients that I treat do not obtain the oxycodone by a prescription because they really want to be discreet and not be found out.
All right, so what's going on here? What's at stake for these people once they start doing this? They're ruining their lives, no?
Right, it starts to head in that direction. So initially, people that are addicted to opioids, it actually causes them to feel energized with a mood lift, less anxiety, and a buffer against pressure. And so that works okay for a while, but eventually they need higher and higher doses, and they don't get the positive benefit. They get negative effects from it.
Right, so they're taking more and more doses, it's just not giving them what they want. So now,
correct.
You treat some of these people with a drug called Suboxone. Tell me about that drug.
Well, Suboxone is known as opioid agonist therapy. It's a different type of opioid than, say, oxycodone. It works much differently. It doesn't cause intoxication when taken at a correct dose, and you don't need to take an escalating dose. And the psychological benefits from it are where people return back to normal. People basically say once they start taking it, they feel fine,
okay.
Not intoxicated.
So are you, though, substituting one opioid for another? Kind of like, you know, the methadone is given to heroin addicts. Right. Are we doing that here? Is that the same thing or no?
Well, you are substituting one opioid for another, but the question that a lot of people have is, aren't you substituting one addiction for another? And the answer is definitely no. With addiction, it can be defined in part by having inability to stop using drugs and alcohol despite negative bad consequences in one's life, as well as causing dysfunction in one's life. With Suboxone, you're actually getting the opposite. You're returning somebody to functionality, and that is the opposite of addiction.
Okay, so then do these people get on Suboxone for a long period of time, or is it something that you're on just for a short period of time, or does it vary from person to person?
It varies from person to person, and that's the thing about addiction treatment, is that it should be individualized.
Now, do you have to see a specialist for this, like the average doctor giving this to their patient, or is this something that someone an addiction specialist manages? What are the restrictions on this?
I mean, basically the restrictions are any physician can apply for the special license to prescribe it. When you have an area like New York City where you have a high concentration of physicians, it's best to go somebody that's trained in addiction. But Suboxone is also being prescribed by primary care physicians, and depending on where you are in the country, that might be the only physician that you would be able to go and see, and that's fine also because it's better than overdosing, for example.
Right. Now there's been some issues, some bad press about Suboxone, right? There's problems with abuse, potentials of abuse, and things like that. Talk to me about that and some of the restrictions on this medicine.
Well, there was an article in the New York Times that highlighted the negative aspects of Suboxone, and the problem with that article is that that's really what it did. It highlighted all the negative aspects, and what it seemed to ignore or touch on just kind of briefly is that there are many, many, many people who have benefited from the medication. They're not overdosing. They're doing better in school. They're getting higher grade point averages. They're getting promoted at work. They're making more money. Their family relationships have improved, and these are things that I see consistently in the patients that I treat.
Now, who would be a candidate for this? Would you say pretty much anybody who's got this oxycodone addiction or any kind of opioid addiction, or how do you break down who's a candidate for the Suboxone therapy?
Well, most people are candidates for opioid agonist therapy. You do need to decide the setting that the Suboxone is prescribed in, whether it's in a solo private doctor's office, such as what I have in Columbus Circle and then in Wall Street in January, or it could be at a facility where there's closer monitoring, where there are groups and therapists, or even at a methadone program, which is actually, some of them are starting to dispense Suboxone as a daily dose, just like methadone, and there's a lot of support there and supervision. All
right, well, Dr. Kloda, thanks so much for shedding some light on Suboxone. Very interesting and important for people because it's a huge problem, this prescription drug addiction. Thanks so much for coming in. All right, well, coming up, food safety for your pets. We're going to tell you all the ways to safeguard your little guys over the holidays. That's coming up straight ahead.